How do you personally deal with that? How do you look at a young child knowing this horrible genetic defect, and then you soldier on, and what effect does it have on you?
I'm not a pediatrician, but I was dealing with my pediatric colleagues at that time, and I have to say that it was terribly painful also for a physician and a caregiver, because of course at that time we couldn't offer too much. I'm going back to the era where the iron chelation was not available even. Okay. So that was terrible to tell parents, and you know, the child was very much protected by the family, by the physician, but it was a difficult time. Now I'm so happy. I say that I'm a grandma of many children from my thalassemia patients, because now they can have their own family, they have their own children. So it's a different story.
Several things have really changed. So thalassemia has really graduated from being a pediatric disease to now being a predominantly adult disease, at least in the Western world.
I just want people to stop and think about that for a moment. What does that really say about medical progress? It's amazing.
It is absolutely amazing. So it's gone from being a potentially lethal disease to being a very, very cumbersome disease. Something that affects your quality of life, but you can still have a near normal life expectancy if you are treated appropriately in a resource appropriate environment.
That is insane.
It is
insane.
And the other thing I should mention is that we lost about 50% of our patients to HIV in the 80s.
I hear you.
And so, you know, the blood supply is so much safer. We have oral chelators. So it's really gone from being a potentially lethal disease, because you never knew whether you were going to get hepatitis or HIV or some other infection, and you didn't have an effective way of chelating that everybody would accept. So now those two things have made a tremendous difference.
The hemophilia population was impacted too.
Yes.
I must say, as a pediatrician, it's extremely helpful to me to have that other aspect, you know, to see what happens at the other end. And of course, we have colleagues like Nika that can help us out. But I think that, you know, you made the comment, you know, how do you deal with this,
yes,
okay, as a pediatrician? I mean, it's terrific. I mean, Sajid's agreeing with me, because now you have, and it's a little, you know, it's a little bit like low-risk leukemia as well, you know, which we cure now.
Yeah.
And so the family comes in devastated that they have this terrible disease, and you can walk in with full confidence saying, we know how to manage this. Your child will grow normally. They will go through puberty. We can protect them from all these problems, and most likely they won't spend the rest of their life with thalassemia, because we're going to ultimately cure them.
And it's great. You turned the table on my question. It isn't terrible to be a pediatrician. It's great. And it's great to deal with this.
I will offer a note to temper that. This is in the developed world.
That's what I wanted
Yes.
to say.
In the developing world,
yeah.
it is
Yeah.
still
Yeah.
a terrible,
Yeah.
terrible disease to have, because you don't have a regular blood supply. It's not necessarily safe. You don't have access to chelators.
Yeah.
They're very expensive. And there, the life expectancy is markedly reduced.
All right.
So this is a very important point, and I think the messages we have to spread around is that it's possible to cure these patients, it's possible to change their quality of life, but there is a need of intervention in many countries.